Guys, you may have seen this man on YouTube recently. This is Dr. Mark Burhenne. He's a natural dentist, and he shared his oral care routine, which I'm going to break down for you guys and share my thoughts on as a hygienist. Let's talk about it. So Dr. B starts by sharing his bedtime routine. This is the most elaborate portion of his oral care routine, and I actually agree with that because our saliva flow slows down at night, so everything that sits in there just kind of festers overnight if we don't remove it thoroughly. So anyway, here's what he does. So he flosses first, then brushes. Funny, I actually do the exact same thing in that exact order. And he explains that technically there's no research that shows flossing before or after is better. But his logic is, get all the gunk out from between the teeth so that the toothpaste can actually reach into all the crevices and work its magic. So I literally tell my patients the exact same thing. There's no research, but logically it makes sense in my mind to floss first. So we're on the same page so far. He also mentioned a curious fact that I never realized before, and that is mint is actually a neural stimulant, so he doesn't use mint toothpaste before bed. Honestly, I felt a little shocked that I didn't know this before, but it makes sense. I mean, every time I use mint toothpaste, I feel a little bit more refreshed and energized. So no mint at bedtime. Instead, just use a fruity flavored toothpaste. He also doesn't use fluoride, and I actually don't either. Look, you can judge me all you want, especially if you're a dental professional, but we know that fluoride is 100% toxic at higher doses. So why bother using it at all, especially if we already have great alternatives like hydroxyapatite, which are biocompatible and biomimetic, and they do the same thing to protect your teeth against cavities. By the way, if I just lost you and you don't know anything about hydroxyapatite, make sure to check out my playlist called Hydroxyapatite for more info on that. I'll leave a link in the description below. Okay, so this next part is very interesting to me. I've never heard of it, but Dr. B actually tapes his mouth shut for the night. He didn't really go into detail about what kind of tape he uses. I'm assuming it's like masking tape so that it's easier to remove. But his reasoning is since our saliva flow slows down, as I mentioned a little bit earlier, the pH in our mouth can actually and does actually drop a little, and mouth breathing can lower the pH even more because it dries out our mouth. So taping it shut kind of helps prevent breathing through your mouth and drying out the mouth even further, because the lower the pH, the higher the risk for developing cavities. Now, I'm gonna be honest, I understand the concept, but I don't know, something about taping my mouth shut overnight just kind of freaks me out. Like, I don't know, what if I need to scream in the middle of the night and I just taped my mouth? I have like internal panic about that. But suffice it to say, I've never taped my mouth shut overnight, and I have been cavity free since adolescence, so I think I'm okay. But I guess if you're prone to cavities and you're prone to mouth breathing, maybe taping your mouth shut is something you want to give a try. So Dr. B also mentioned that he keeps his window open at night just to keep the CO2 levels low. Like, he actually has a CO2 monitor that he has in his bedroom, and it reads the CO2 levels. And he mentioned that when he leaves his window closed, he noticed that the reader has like really high CO2 levels, which basically affects our breathing, which can contribute to increased mouth breathing, which again dries out the mouth, pH balance, that vicious cycle. Now, this is another thing that I've never habitually done. In fact, I remember my mom used to always tell me, don't sleep with the window open, because apparently the cool breeze or whatever can like make your muscles tense up and you get a sore neck the next day or something like that. And anyway, I kind of live in a sketchy neighborhood right now, so I don't know how I feel about leaving my window open at night. I guess just a crack if I really wanted to, and then put a little door stop or whatever. But yeah, he opens his window, I do not, and my teeth are still okay. Moving on to the morning. So first thing Dr. Burhenne does is he hydrates, so drinks a glass of water. I actually do the same thing, but for slightly different reasons. He explained that he does it for his oral health, get the saliva flow going, rehydrate the mouth. I've always just done it to kind of get my whole metabolism going, wake up the gut before I stuff it with breakfast. But regardless, we both hydrate in the morning, first things first. Then he brushes with mint hydroxyapatite toothpaste, fluoride-free, SLS-free. And actually, funny enough, before I even watched his video on the oral care routine, I recently switched to a hydroxyapatite, fluoride-free, SLS-free toothpaste. So cool, again, we're still on the same page. In fact, if you're curious, I'm using David's nano hydroxyapatite toothpaste right now. It's good. They don't disclose their percentage of hydroxyapatite though, and apparently that's pretty important. So I'm currently also researching Dr. Jen's toothpaste. So anyway, if you guys want to, you can check out my review on David's toothpaste. I'll leave a link in the description below, or also stay tuned for my review on Dr. Jen's toothpaste coming up soon. But anyway, so he drinks a glass of water, then he brushes with mint toothpaste, and then he doesn't floss floss, there's really no need since he just flossed the night before and didn't really eat anything between then and the morning. And same with me. Usually in the morning, I just brush my teeth. Then he mentioned he does some oral exercises. I don't know. He didn't go into depth with them. Maybe something like... Anyway, and then after lunch, he does not brush his teeth. He actually just chews xylitol gum. Now, I personally used to brush and floss my teeth after every meal, but then I noticed over the years that I've been getting a little bit more sensitive teeth and maybe a little bit more recession, even though I'm not really aggressively brushing. So I don't brush between meals anymore. I agree with the xylitol part, but not the gum so much. Most chewing gum contains some harmful sugar alcohols, while the natural stuff contains actual sugar, which is counterproductive. So I prefer to skip out on the gum altogether, and actually I just use these xylitol ice chips. They're basically mints made with xylitol and peppermint oil. They actually come in a lot of other flavors as well, but I just like the mint to kind of freshen up my breath. And again, just in case you didn't know, xylitol is a type of sugar that helps break down the cavity-causing bacteria. Basically, xylitol kills bacteria that causes cavities. So that's around lunchtime. Then, after dinner, Dr. B waits 30 minutes before brushing just to kind of balance out the pH. And then he does his bedtime routine. So I'm going to be honest, I never watch for the time between my meals and brushing or flossing. I feel like there are so many other things that I have to be mindful of in terms of timing in my life that I just don't even bother with checking how long it's been since I've eaten before I brush. I do, however, at least rinse with water after meals just to help balance out the pH a little bit faster. It's a super easy step and I actually recommend it to everyone, especially like kiddos. After meals, just get a little rinse of water to kind of flush things out. But anyway, after Dr. Burhenne has his dinner and then goes through his bedtime oral care routine, that's it. No snacks, no nothing, just sleep, and then wake up in the morning. No food until breakfast. And this is where we part ways. There is no way I can make it through the whole night without having some sort of snack before bed. I have a really fast metabolism, or I don't know what's going on, but usually, after dinner, I floss and brush, get my teeth squeaky clean, and then oftentimes I find myself grabbing a little snack before bed, and I don't always brush and floss after that snack. Again, I try to at least rinse with water. I may go over my bedtime routine again. Basically, what I'm trying to say is, yes, ideally, no food after eating dinner and after brushing and flossing until breakfast time. But I will not judge you if you do, because oftentimes I do as well, and I'm still alive and my teeth are still okay, so, do what you gotta do. By the way, before I give you guys the last little shocking tidbit of knowledge from Dr. B, if you found this video helpful, make sure to give it a thumbs up and subscribe for more videos like this. I also do monthly giveaways, so stay tuned for those. Thanks for your support. Okay, as promised, the last shocking tidbit of knowledge. You may have already noticed, but Dr. B does not use any sort of mouthwash in his oral care routine. He goes into detail about this, but basically any type of mouthwash use contributes to high blood pressure. I didn't know this. Even the natural stuff has essential oils in it, which disrupts the nitrate reducing bacteria in the mouth, which helps to regulate blood pressure. So basically, Dr. B says, don't use mouthwash. Funny enough, I actually have never been a huge mouthwash user anyway, not for that reason, but I just find that it's super overkill. Like, I'm already flossing and brushing, and then with the toothpaste, you kind of rinse it. It almost acts like a mouthwash in and of itself. So I've always felt like mouthwash is just a little extra. But now with this knowledge, I definitely won't bother. Now, obviously, if your dentist prescribes you a specific medicated mouthwash, please use it, listen to your dentist. But if you're just using mouthwash prophylactically, just stop. All right, well, overall, it looks like we have pretty similar routines, so I approve. By the way, he talked about a lot of other things, so I will include the link to the video that I referenced below, so you guys can check it out if you want. Otherwise, thank you guys so much for watching, and I'll see you in the next video. Take care of your teeth.